Welcome to the Business Partners to Convince Fireside Chat. Today's discussion will be around global pandemic response and business recovery. Where do we go from here? Our moderator today will be Dr. Scott Ratzan, Executive Director of Business Partners to Convince, who will be speaking with Lawrence Gostin, Professor of Global Health at Georgetown and Director of the World Health Organization, Collaborating Center on Global Health Law. I now introduce you to Dr. Scott Ratzan, who will be moderating today's session.
Good morning, good afternoon. We're really happy to have a fireside chat today with Professor Gostin. Before I even introduce Professor Gostin, I would like to give a couple of background slides on what we're doing with, you might wonder, Business Partners to Convince, as well as our ongoing engagement to address the COVID pandemic. The next slide reminds where we are. So as mentioned, I'm Scott Ratzan, along with Nancy Lee and Heidi Larson. We founded a global coalition that we called Convince, the Coalition for COVID-19 New Vaccine Information, Communication, and Engagement. We launched this at the United Nations High-Level Political Forum now 2 years ago, and worked to advance a forum and clearinghouse for multi-stakeholder efforts to manage the complex, nuanced, and immense public health challenge. We had this idea with the work that we have done, myself with my academic career and otherwise, on the challenge with vaccine hesitancy, as WHO had identified, also the work with Heidi in the past on vaccine confidence, and also with Nancy of Wilton Park on a number of dialogues on this area. What's most important is number 4, the private sector, that we form Business Partners to Convince. And the next slide shows when we did this, we brought together a broad network amongst the business community, perhaps one of the largest and most in-depth in the world, which includes the International Organization of Employers, the International Chamber of Commerce, Business at OECD, and a variety of other national and international groups there. And fortunately, we've also been able to have Larry involved with Georgetown, Heidi with the London School, myself, my academic work at CUNY School of Public Health, and a variety of others there. But what we want to hone in on today in our discussion, but as well as what business can do, is that business is a trusted source of information. And that's the piece of what we're trying to do today, to remind of the importance of the private sector and multi-sector responses, and also to get a perspective from one of the global experts. And I've been fortunate and lucky to sit on the National Academy's Board of Medicine, Board of Global Health with Larry. And have also been fortunate to have written articles in a number of places, hopefully that will make a difference, and I call it our public health plight. So let me take this opportunity to introduce Larry, and then it's more to be a chat. Larry Gostin is university professor, which is Georgetown University's highest academic rank, and he's the founding O'Neill Chair in Global Health Law. He also directs the World Health Organization Center on National and Global Health Law, also at his institution. He served on high-level advisory committees for the WHO, including the World Health Organization's reform, smallpox, pandemic influenza, and genomic sequencing data. He's working with WHO on the global 19 response, including impacts on the health workforce and international migration. He continues to serve also on the WHO Global Fund's Blue Ribbon Expert Panel on Equitable Access in Global Health, and co-chaired the Lancet Commission on Global Health Law. I'll keep going because I think it's very impressive, and we're really fortunate to have Larry today, as he also serves as a member of the independent panel for a global health convention and on the panel for the Global Health Security Index. And then finally, most impressive, not only the book behind me, but Larry's latest book, Global Health Security, A Blueprint for the Future, from Harvard University Press. It won the prestigious Association of American Publishers Prose Award for the best book on professional and scholarly excellence in the biological and life sciences. As you know, Professor Gostin has just been terrific, and I'm fortunate to have this opportunity to chat with you today. So I'm going to just turn over sort of the first question, and then hopefully the next 40 minutes or so we can have a discussion here. And the first question, really, you're the expert, if not the world's expert, in global health security and leading the WHO Collaborating Center and so forth. So from your vantage point today, What do you think are the major challenges we're facing?
Well, first of all, thank you, Scott. It's just a real great privilege to be with you. We've been close friends and partners and colleagues for many years now, and I really do treasure it. You know, we have so many multiple challenges. But I think I would mention a few. The most obvious is the one that most evaluations focus on, which is health systems. The WHO's Joint External Evaluation, you mentioned the Global Health Security Index, the Global Health Action Agenda that the US led, and a whole range of other evaluative instruments. They all focus on health system pandemic preparedness, things like surveillance, response, laboratory capacities, the ability to find and treat and trace cases. Those are all the kind of core functions. They're required to be developed under the international health regulations, but most countries actually don't have those capacities. But we found during COVID-19 that, you know, the countries that scored best in these evaluations, so for example, the United States scored the highest in the Global Health Security Index. The UK was second or third. European health systems, Scandinavian health systems were very high up there. They all performed very badly. And so there were a few other things that I'd like to draw people's attention to. One is trust in science, public health, and government, which seems to have broken down during this response to the pandemic. And then the third is equity, the equitable distribution of global public goods. I'm doing a project with WHO. I had a Zoom this morning with them, and again on Monday, on a project that is going to look at how we might structure the pandemic treaty to do a better job with equitable equity. And by equity, I mean two things. I mean, one is the equitable sharing of scientific information. You really can't have innovation unless you have this kind of sharing of virus samples, genomic sequencing data, and other key scientific research. And the second is that when you have the fruits of that scientific research, diagnostics, vaccines, therapeutics, and the like, you need to be able to distribute those in a globally equitable way. And that is another thing that's really broken down during COVID-19. It had actually broken down well before COVID-19, but I think COVID placed a spotlight on the problems of deep injustice and deep inequity. And we saw it with vaccines, diagnostics, personal protective equipment, and we're now seeing it with antivirals like Paxlovid.
Yep.
So I think those would be the main areas that I might focus on: health systems, equity, trust in science, and government.
Well, Larry, you mentioned a lot from the WHO there, and I know you've been actively involved, and clearly we had the last administration that, if I could say it lightly, was not positive about the WHO, notwithstanding the future and its normative and policy leading role. A lot of people continue to criticize WHO or what they're doing, and according to the Wall Street Journal yesterday, called the editorials, the WHO's climate neurosis, ending that the WHO lost credibility after being late to raise alarms about COVID. And then it ends with, like many bureaucracies, it wants to expand its authority despite failing its core responsibilities. What do you think the future is with WHO and some of specifically as the leading UN organization chartered in 1948 to help us not only address pandemics, but as you mentioned, all the other health security areas?
Well, there's no question that WHO was caught in the middle of a global political struggle between the two great superpowers. And President Trump even did the unthinkable. He sent a letter to Guterres, the General Secretary of the UN, giving 1 year's required notice of US's intention to withdraw from WHO. Nobody could have ever imagined that when you think about how we formed WHO and the vital role that the US and Eleanor Roosevelt and others played in it. And WHO certainly made errors, as did the US CDC during the pandemic. So it didn't act perfectly. Oddly enough, I think WHO's future is brighter and stronger now than it's been in the last 20 to 30 years. Since its heyday, when it led the drive to eradicate smallpox, and more recently in the drive to eradicate poliovirus. Since then, WHO's authority and trust by governments has waned. There's no question about it. But I think COVID-19 has really, if anything, enhanced WHO. And we saw that in the World Health Assembly. For the first time in a generation, the Assembly voted for sustainable financing for WHO, including the US changing its position and supporting a more robust financing structure for WHO. So sustainable financing looked like it was doomed. It passed in the World Health Assembly, in the 75th World Health Assembly. The pandemic treaty is moving ahead. Just this week, the international negotiating body met. The zero draft of the treaty is due out in late July or August. And there's also a US-led IHR, International Health Regulation Reform. So all in all, it looks like WHO is going to have more power, more authority, more resources to do its job than it ever is. Now, there's been a backlash. I can't tell you the number of times I've had fact checkers from the world's greatest fact checking organizations, asking me whether these conspiracy theories about the pandemic treaty and the IHR are true, which is basically that WHO could make, healthcare policy decisions for America and decide how doctors treat their patients, which is total nonsense and conspiracy. Yeah. So there are headwinds, Scott, but I think overall, WHO is in potentially stronger position now than it's been in decades.
Well, thanks for explaining that, as well as the importance of being prepared for not only, as you said, the international health regulations, the zero draft, and the pandemic treaty moving ahead. And like you say, despite the Tucker Carlson's and others that are claiming some conspiracy, I think there's a...
Yeah, it was Tucker. He was one of them. That's right.
Yeah. We need to set this record straight, fairly quickly, as much as we can. But you also mentioned the CDC, and I know that we've also been critical of the CDC's communication or poor communication on a variety of areas. And just for fun, the Wall Street Journal yesterday reported the CDC drops monkeypox guidance on masks. So the CDC had some guidance on masking for monkeypox, while I know WHO and others have been saying it's really not an issue, and it's certainly something that an issue to worry about with masking. So what is the future for public health authorities to have measures that matter and doing a better job, if we can say?
Yeah, well, let me just on monkeypox and masks. Monkeypox is, traditionally it's transmitted by close contact. We've seen it with sexual or other contact, but you need intimate contact. And so it's possible that there could be a droplet transmission, in which case a mask would help. But there isn't a generalized risk for the population, so there is no population-based mask recommendation, but only very specific for those who either have symptoms of monkeypox or in close contact with them. The CDC it's been perplexing during COVID-19. They've always been the world's greatest scientific organization. And yet during COVID-19, it's just remarkable that if you actually think about how the US has made its decisions, FDA, CDC, HHS, it's based upon data from foreign sources, UK, Israel, South Africa. We're using all their data about, the durability of vaccines, the effectiveness of various interventions. And so it looks like our data systems are weak, they're outdated. Part of it is that CDC has had weak health data infrastructure, although that's been recognized by the Biden administration. We put some funding into it, so I expect them to do better. But the other part is the federalism, and just they're reliant upon the states to give them the data. We don't have a national health service or anything close to a national health system. And so scientifically, CDC hasn't performed as well as I would have expected, because I do think of them as the crown jewel in science around the world. Communications wise, and you're the world's expert on this, Scott, they've been extraordinarily weak. That I think was expected, because they just don't have good health communicators in CDC. They're mostly research scientists. That needs to change, as you and I have said. They need to gain a lot more public trust. They need to have a lot more bottom-up community outreach. And you can just see it, in our very, very low penetration of vaccinations in the United States compared to all of our peers. And it's even worse among children and adolescents. From the 5, to 18 group, we've got extraordinarily low vaccination rates. And, we expect within the next couple of weeks, FDA and then CDC will recommend that primary vaccine series for under 5s. I expect to have extraordinarily low uptake of that. They have to just do a better job. I mean, you did most of the drafting in an op-ed for the Daily Beast that we recently had that, called for, a real push on childhood vaccinations. I thought it was extraordinarily perceptive and something that you've been the leading voice on, Scott.
Well, thanks, Larry. In fact, it's interesting because I did a segment on world business for CGTV, I guess just 2 nights ago, and they also brought on the importance of childhood vaccine, and I highlighted the challenges as you just mentioned. And the unfortunate thing is that I don't think that the U.S. is prepared, as you used extraordinary low, to get the vaccination, and it also ties in with the global challenges that were in the World Bank report. The World Bank report just came out 2 days ago on the whole inflation situation and the economy warning of or global recession. But in some of the coverage, it put the importance of COVID, and the final quote is, renewed outbreaks from COVID-19 remain a risk in all regions, particularly those with lower vaccination coverage. And I think the fact of them even focus on vaccination is we know that's the way out, and the challenges that we face globally on the equity that you mentioned early, but also in the US are a huge challenge. So do you have any thoughts on, yes, we've written the CDC should do better. Are there other places for the political or scientific, medical, or global health community to engage?
Well, there are lots of places, that we need to engage. I mean, it just seems like um, there's so much happening right now that we have to kind of wrap our hands around. Um, for me, I would make sure that we really do have, strong global governance and good health communication. The health communication side has not just been a problem at CDC, it's also been a problem at WHO itself. You'll remember, early on about all of the problems at WHO and CDC about uh, uh, things like masks, whether they were effective, whether there was aerosolized spread of SARS-CoV-2 when it was thought to be mostly droplet spread, asymptomatic transmission of SARS-CoV-2. We've had a lot of that. One of the things about vaccinations is, what the future looks like with vaccinations. Just yesterday, Moderna made an announcement that it was seeking approval for a new bivalent booster dose for the fall, which would be a booster dose that includes the original Wuhan strain of the virus plus an Omicron specific strain. And I'm on this small global, I don't quite know how I got on a small global group of scientists that are the top vaccinologists, immunologists, epidemiologists in the world. And they've been debating, what future vaccine composition should be. There's a real divide amongst the best minds in the world about whether Omicron specific variant targeting vaccine or bivalent vaccine is the best way to go or not. FDA's advisory panel is going to be discussing this in the next week or two.
Yeah.
So there's a lot going on.
Sure. No, I mean, we haven't, maybe it's not the scientific place to discuss it, but we do know there's BA4 and BA5, these subvariants of Omicron that are in South Africa now are supposedly, according to the CDC, 13% in the US, I think 5% of BA4, 8 of 5. And there's a recent Nature article that suggests the current vaccines do not give protection, nor does our natural immunity. So we're hearing this, and I'm just hearing it as, frankly, a public person. I don't have any privy nature to the info as you do. And it does seem a concern that we have to communicate this well, and that hopefully the U.S. government is going to purchase these, as I think some governments already are thinking about it, maybe more than we are here in the United States.
Yeah, I mean, Germany's or actually about a month ago already, or maybe more, purchased bivalent vaccines. The U.S. is, FDA is still, as I say, is still going to have to decide this. There's a lot we still don't know, Scott, on this. The fact that these subvariants will are becoming quite effective at evading vaccine protection and also evading protection from prior existing disease. So basically, we're seeing a lot of reinfections and breakthrough infections. It really is going to depend on what our endpoint is. Right now, the vaccines are doing a really bad job at preventing infections. And that's really not ideal. You'll never get to anywhere close to, let alone herd immunity, or even slowing the virus unless you can prevent these kinds of infections.
Yeah.
But they're still doing a good job at keeping people out of the hospital and preventing them from dying. And so that may be the endpoint. The Moderna press release said that that it was superior in its antibody response, which suggests that it could prevent some infections. But that's just 1 month out after the booster. No clarity as to the longer term effects. And so we're going to have to do a better job at understanding where the variants are going, and also a better job at formulating our vaccines. Now, whether we're going to see a future somewhat like influenza, where we've got changing vaccines are changed once a year, or whether we're going to see this happen just repeatedly, that, I think the American public could tolerate, once a year flu and COVID jab. Be a lot more difficult if we're going to have to keep up to date 4 or 5 jabs a year for COVID.
Yeah, you just painted a challenging picture then for this end game for COVID, even at the end point for vaccines. So what do you think an end game might look like, or when? I guess it's sort of, I don't have the crystal ball, but
yeah. Well, it's so interesting. About I don't know, it was a little more than 2 years ago, 2.5 years ago. I had a conversation with Maureen Dowd at the New York Times, and she asked me, well, how long is this going to go on for? And so I said, the interesting thing is that, everybody's saying, well, we don't know. And I've often said it, we don't know, but I think I do know, I said to her, because if you look at history, most of these pandemics, have a trajectory of about 2 to 3 years. And she wrote about it, and I was pilloried for it, thinking I was a negativist. Now we only wish that it was 2 years and it'd be over. So you have to have a little bit of humility in making any prediction about COVID. But I would think that we're living with COVID will be a combination of continuing to be vaccinated. I don't think it's going to be, a 4 or 5 time a year thing. I just don't think that's sustainable. But it's possible once or twice a year we're going to need boosters for COVID, and then we may have a different strategy for more vulnerable people like the elderly, immunocompromised.
right.
At the same time, I think we're going to have to do better with our therapeutics. Paxlovid is very good. It's the antiviral from that really can prevent hospitalizations. But we've seen a lot of rebounding, that the virus rebounds with the use of Paxlovid. So we need better data on how long you have to take that to suppress the virus. And so I think it's going to be one of these nasty pathogens that's going to be with us for quite some time, and we're going to have to manage. But over the long term, it may turn out to be, just like other coronaviruses, that we'll just keep getting, but they'll be like, really bad colds. I would say that that's our longer term future. Our future up until the end of this year is one of uncertainty, in which is the next vaccine. Then we'll get into from 2023 onward, we'll get into a better rhythm about the number of vaccines we need and the kinds we need. And then after that, into toward the end of the decade, we'll start to see this fade quite considerably into the normal background.
Well, thanks for presaging. We also, at Business Partners Convinced, knew this was not going away. We knew the vaccine would be so-called showstopper, but we also knew it was going to take time to get the vaccine out there for people based upon, other data. And we maybe projected a couple years, and we've been pivoting with some of our work with a workplace challenge and other pieces we'll get to. But you've got me thinking, you snuck in, you said the end of the decade. So you really think it's a number of years out. So how do we build the trust that we need? Not only the trust back in science, but also strengthen the trust of business with an active role, or even the private sector, to help get us, if I could say, quicker than the end of the decade, if we were talking about 2025.
Yeah, no, when I say the end of the decade, I'm really thinking about a gradual coming to grips with this. But I do think that we're going to see, at least for another 5 years, COVID causing hospitalizations and some deaths among the vulnerable. And then it will, become like an influenza, and then by the end of the decade, it might be more like a cold. So I'm thinking really long-term thinking.
Mm-hmm.
We do need to build trust. It's really hard. I mean, obviously, there are clear things we can do. I think, there's certainly a role for business. The role for business is multiple. I mean, their employees and their customers, in terms of education and inclusion, is extraordinarily important, because businesses, interact with, virtually all of society, and they have an enormous role. Beyond that, there are many, many businesses that have, that are kind of civic partners in their communities, because they're so close to their communities. And these are not necessarily, but they can be, multinational, but really just businesses in the communities can be very influential. They can partner with community-based organizations, with cities, counties, towns, to help educate. Beyond that, I think it's really important to engage in a bottom-up strategy, looking at civil society organizations, NGOs, are very important. Religious churches, mosques, synagogues, other places of worship, community centers, places where older people might go to recreate and socialize. We need to really be there at the ground up, because there's still some trust in local groups, local businesses, local recreation and other entities, and even local government. It's really the national where we've got our major challenge. So I would work from the bottom up.
Right. So thank you for that, Larry. And before we go to a question that's in the chat, I'll just sort of one follow up that links to that, is that you said the business with the civic duty, and there has been a movement over years for global health diplomacy, which generally has come from states, but clearly the private sector believes they have a role as an interested party in this global health diplomacy world. So the beginning, you mentioned the pandemic treaty, the zero draft, this WHO linkage. Is there a role for the private sector to engage in any way also on some meaningful impact to address some of the challenges, not only with communication that you mentioned, system strengthening, equity, and other areas? Or is this something as observer status at this point, and try to work in a different way for really what we all need? I mean, I always call health our common currency. So I think if there is a treaty, we have some engagement from multiple sectors.
I agree with you. I think Tedros, who's the head of the World Health Organization, would welcome it. He obviously, there are certain industries that play an outsized role, pharmaceutical industry and vaccine manufacturers, laboratories, academic institutions, things like that are also large employers. But I think businesses per se, I mean, first of all, there's a lot of expertise in business. If you think about just one clear example, you've got probably we're getting to a point where we've got ample vaccine supply in the world, but we can't get into people's arms. So logistics, Coca-Cola can get an ice cold drink to somebody in a rural area. So they're very good with supply chains, logistics, and that's really the currency of global health right now. And so yes, having partners would be good. Rotary International, for example, has been very, very active, particularly on polio eradication. They're one of the main partners of WHO.
Well, great. I mean, we're hopeful of the engagement, and I'm one of the important questions in the chat comes from Abby Shapiro, who's our lead with USCIB, the U.S. Council for International Business Foundation, and with Business Partners to Convince. And she has something that maybe becomes fundamental, a challenge that you raised as well. Vaccine hesitancy still remains a big problem. Misinformation's everywhere. What more could employers' business do to communicate a positive message to their employees on vaccines and encourage vaccination?
They can tell people the facts. They can have vaccine campaigns, just like the way that many businesses do with influenza drives. Mm-hmm. Same thing with COVID. But it can cut both ways. I tweeted something about a week or two ago because I took a photo of it. I happened to be visiting my granddaughter in Florida, and I went to one of the biggest food markets in the state, and it had a great big sign outside that basically from the CEO saying that I'm not a doctor, but here are all the reasons why you should never get a COVID vaccine, and started listing things, all of which were half true, like it won't stop you from getting COVID. Starting with that, and then it goes on and on and on about really trying to convince all of their customers not to do it, and employees. Of course, it didn't say the one thing that's relevant. If you get vaccinated, you got a much better chance of living. But so businesses are usually for the good, but they're not always for the good. Mm-hmm. And so actually the business community could try to encourage, a more factual, evidence-based, consistent voice among its members.
Mm-hmm. No, I mean, that's a good point of all businesses not being alike, but clearly that what we've tried to do with this coalition is build
that. I know.
No, I appreciate and thinking of it. And similarly, we use the word vaccine as if they're all alike and similar too, and there's some confusion there, right? When you have not only the ones that are approved in the U.S. now, Novavax, and you have the AstraZeneca, Oxford, then you have the Sinovac, and then the Sputnik. Yeah. So I mean, even in thinking about all that, are there other pieces that the business community should weigh in on with the public health authorities, or is there a way to drive some of this, directly, like you were suggesting, of just communicating with employees and the networks?
Well, I think businesses are actually very good at partnering with governments and also even international organizations. There's a lot of interaction between UN agencies like WHO and the business community and the business sector. So I think there are ways to influence. There are ways to partner with major initiatives. The pandemic treaty might very well be one. And if you think about the pandemic treaty, there are a lot of kind of business interests that are very closely connected to what that treaty is likely to look at, land management, will probably be one. Energy use and climate change will probably be another. Food um, uh, uh, and the selling, particularly of animals and food markets. So there's a lot of specific industries that are quite central to what's happening. I'm one of those, in my field, there's a lot of bashing of business, particularly the pharmaceutical industry and other businesses, multinationals and things like that. And I have got my eyes wide open. I do think that sometimes businesses can, lobby for their own narrow self-interest, but I've seen so much good that's come from business. Good in the products that they provide, and good in the kind of civic engagement that they do, and good at the partnering that they do with governments and with international organizations and UN agencies. So I think focusing on that civic responsibility would be just amazing, because frankly, there's no sector of society that has the capabilities, the expertise in almost every field that business has, including science.
Well, thank you, Larry. Those are really uplifting remarks of what we're trying to do. And I know we are recording this. We think a number of people will be watching this later. And I think much of what we've said is timeless. These are long-term issues that we all want to work together on. I think you've also just laid out a really important role for what business can do. And I think there's other ways that we can help get this message out there. So I'm going to end by just asking if you have any questions or any final thoughts. We will then, we have one final slide to show our audience, but
Okay.
what do you think?
Yeah, I would just, if I was going to leave, a parting message is that, this pandemic is a wake-up call. And I think all of us in the field, believe that the frequency and severity of health crises, and particularly from pathogens, novel pathogens, it will only increase going forward.
Mm-hmm.
We've already on the alert, with monkeypox, although it's not anything close to COVID-19, but there are there are other coronaviruses, SARS, MERS, there's hemorrhagic diseases like Ebola,
Mm-hmm.
and there are novel influenzas, a whole range of, and as WHO says, there's disease X. And so we've just got to be better prepared to be able to respond. And I think that that's an all of society problem, from governments to business to civil society and others. And I hope that COVID-19 will really be a wake-up call for us, and that we're not going to just go back. As you kindly mentioned, my book on global health security, the theme of that is that we lurch from complacency to panic and back to complacency. Hopefully we're not back to complacency, and we're seeing some signs of it. For example, the failure of Congress to agree on supplemental COVID funding.
Yeah.
So those are my only final thoughts. Just thank you, Scott, and thank you, Convince. It's really it's a privilege to work with you, and got a lot more to come.
Well, no, thank you so much, Larry. It's a real privilege to work with you, and thank you for joining us and giving these pearls of wisdom. I think the wake up call is a great reminder, and we wake up every day and we have to think about these challenges and the intertwined nature, as you mentioned, of the pandemic treaty and others that deal with our climate issues, which then bring vector-borne diseases and others that we haven't seen in different parts of the world, withstanding recent Zika and what's happened with malaria and so forth still. So there's a lot to do. We focus a lot on infectious disease, and there's other challenges that we have around the world in non-communicable and other areas. But right now, hopefully the wake-up call that you're calling for, the global health security that you're the world's leader on. And again, congratulations on the book, and sharing this with us, with Business Partners to Convince, has really been a privilege, and we'd like to thank you again. And hopefully we'll be able to do this again with I want to say renewed optimism as we continue in this decade. And some of the pearls there of Congress should act more. The global communication effort should be stronger. Our efforts with business as a fundamental, from the consumers and the customers that we have to the employees to our networks. So it's all been terrific. I know we tried to get this to a time that we would have a great conversation, which I enjoyed, and I hope our audience has. And we, like I said, we may, I think there's some parts here that will be in great written form as well. So I know we'll be keeping at it. So with that, I'm gonna close and thank you, Professor Gostin. The last slide I'll show is our workplace challenge.
Thanks.
And those of you might know, we developed this with our steering committee and others. And we believe that companies can engage in a meaningful way with their employees. And it's basically simple. We call it a challenge, and you see it's in English and Spanish. We put the Spanish on the right just to make sure you can see if we translated the 6 items for the challenge on the left. Listen to employees, right? We always want to know who we're serving and what we can do. So we listen and address COVID-19, follow the latest public health guidance. And we spoke about the public health guidance, whether it was masks or vaccines and so forth. Protect myself, employees, workplace, my customers, my community. I think Larry had honed in on every one of those being important. Promote vaccine literacy. Again, from the misinformation answer, it was, we had all the reasons why vaccines don't work, but we didn't have the point of how they do work and how they have prevented disease and so forth. Encourage vaccine confidence and uptake. That's on the local to global level. So we can do what the World Bank report is hoping to bring our economy back, that vaccination is key. Advocate for accessible, equitable, and timely vaccination for employees. We would like these to be equitable. Most governments are providing these at no cost to the individual, but that doesn't mean they're not free for the government. So we have to continue to advocate that everybody should have access. And then finally, engage with communities, schools, faith-based organizations, and public health leaders to stop the spread. I think that's probably the piece of why many of us are members of society. Yes, we're both in society, we're also part of business. We're also part of other civic society sectors. So we can do this all together. And we thought the workplace challenge was something. We've had a number of companies around the world that have joined. We still have a lot of different resources if you go to that website that's there, and the website also that we have, businesspartnerstoconvince.org. There are a number of resources, as well as we'll have a replay of this event and a number of other ones that will also help those of you who are both developing workplace policies, workplace interventions, and ways of making your workplace safer and productive. So with that, that's the goal with the challenge. Our final bit is to remind that we want to continue doing this, although we would like to say that this is near over. Certainly Professor Gostin didn't say that. Dr. Peter Marks of the FDA, warned earlier this week that we're not even close with what the U.S. government has done, and particularly with communicating to get the demand up for vaccines. We believe vaccination for a healthier planet is important, and you even heard Professor Gostin mention that means whether it's flu vaccine or some of the others that we've been able to be most successful around the world. Of course, we've got rid of smallpox, almost finished eradicating polio from the planet. And we've made in many places measles, mumps, rubella, a variety of other preventable diseases that cause a lot of harm. We're making them less and less and less. And we'd hope to do the same with COVID. So with that, if there's any final questions, we have the opportunity for you to email us to put in anything, with this. And I'm gonna, I think, sign off. Jen, is there anything else to add at this point here?
No, but thank you, Scott and Professor Gostin, for this dynamic discussion. This concludes today's Business Partners to Convince webinar. A copy of the recording will be available both on our YouTube channel and on our website. We thank you for joining us today.